So I saw when he was 45. And he was just, they gave him all sort of drugs and for his psychiatric, for mental illness, and in fact he just had Lyme disease.
It's really sad to hear. Really sad.
I would like to focus on the immune system from a different way, related more to bacterial infection. As I do not follow the traditional microbiology, I'm rather a biomorphist. I'd like to stress the focus on the studies Lynn Margulis did, one of the most famous biologists. She died, unfortunately, last year. And she did a lecture here in Berlin, at the university in Berlin, in 2008. The paper is published in English. And she found out that the spirochetes lost about 80% of their genome. So, but one, which causes leishmaniasis. So, and can live outside of the body of a mammal. And she asks, of course, if there is a loss of 80% of the genome, and we can find these spirochetes, which are plenty, the periodontal spirochetes, for example, which are related to inflammation in Alzheimer's, or others. They are since millions of years in mammals. So I'd rather stress more on the immune system, because I think most of the spirochetes are in us. And the infection, so-called infection, is just pushing the problem we have already in ourselves.
Yeah, and that's true. For example, the VDRL test, the syphilis test, is often false positive in our patients.
Yes.
Weekly false positive.
Yeah.
You find that a lot. And that, I think, just goes into that direction.
But could it be because it's mainly women as well? Because it's
No.
as well?
Yes.
It's mainly women who have this little problem
Well,
with the test. I take lots of syphilis tests. So. HIV testing, syphilis, hepatitis, that's what I know.
There's a question. Sometimes it starts with flu-like symptoms. Yes, you just stated that. And you see at the work of Yamamoto, he is observing a few cases of people with the flu. Yes, and they have increased NAGAlase after day 3, and to my amazement, it's still increased after about 60 days sometimes. So, do you think this flu infection is the decrease in your immune system by people are more prone to develop the other infections?
I'm not so sure that the short-term NAGAlase increase is such a problem. I think the long-term, over months and months and months, is a problem.
Yeah, but 60 days is still increased.
Yeah,
it's a long time,
but
in my opinion.
are you sure that these people don't have anything else?
Are you sure what?
Are you sure these people don't have anything else?
I don't know, because of just the complication. That's a compression, yes.
Because it could well be that these viral infections turn on something. They turn on other things that are latent, and they could be responsible for the increased NAGAlase. It's not logical that a simple flu infection, which gives you maximum a week of cytokine reaction, will turn on your NAGAlase for 60 days. I mean, that's not very logical. So I think it turns on something else in some people that have latent infections.
Yeah, the problem with the Yamamoto, it's only 3 or 4 patients only.
Yeah.
60
I mean,
days. So.
if he comes up with a series of 100 consecutive people, I would believe it. But the 3-4 people just taken out, and why do people are included in a thing? I mean, I teach in 4 different faculties. I also teach in first years of psychology, and you should be there are 250 to 300 students in there. and there are at least 60 to 70 there because they have huge personal problems. And they would be taken all as normal people if they would do a study saying, now take 300 normal, healthy psychological students. And there are at least 60 or 70 in there, and I'm sure there are people in there with Lyme and with other problems that are not diagnosed. I mean, it's incredible, you know.
And that's a really important point because there's a lot of psychological research is done on psychology students.
I have to work
Yeah.
It's who's normal.
Doctors always have a special treatment with psychologists.
Just regarding further test, you said it is publicly available. How can we obtain?
I'll give you some information.
That would be great, thank you. Because I'm thinking this may be very applicable to, because I've seen also with Gcmaf, sometimes people respond very nicely, but then you see an inflammatory response about in 6 months, and you're wondering, where are you going with this? What is going on? Where did I miss? And that's what makes me wonder. Another test besides Nagalase, because we've seen presentations yesterday, I don't know if you were here yesterday, but presentations showing that Nagalase is going down, meanwhile cancer is going up. So, looking at
I don't think there's a good correlation between the two of them, because at this moment we are looking at the different origins of Nagalase.
Yeah.
So we have a grant from the Flemish government to look at the different origins of Nagalase, and that is underway, that research is underway, because it's not all coming from viruses or cancer. I mean, you need to know where it comes from. And that's being studied right now.
So something Fagot test will give us maybe another.
Fagot test is another way to look at the immune system, how it responds. If your macrophages are lazy and not doing much, there can be several reasons, but the Nagalase Gcmaf system can be one of them. There are other reasons why your macrophages are not. If they're intoxicated by nitric oxides, for example, nitric oxide, that's why I give B12 to everybody. I'm the B12 person, so I give B12 to everybody because it neutralizes your peroxynitrate, which is your biggest enemy of your macrophages.
What kind of B12 you give? What kind of
I give hydroxy because of the methylation, the methyl, and not cyano. So I give hydroxy.
Not methylcobalamin?
I give some methylcobalamin, but for the specific, if we do a test where we measure NO activity, and so then I know how much B12 and how long I need to give it. You can see that on the lipids, in the peripheral lipids in the blood, if they're all oxidized, then you have a lot of NO. Your lipid oxidation tells you how much NO you have in your body. And it's another reason why your membranes are distorted. And I personally think that B and T cells that live 1 year are also very harmed by this peroxynitrate. That their membranes are not intact anymore, because O and O negative, is the strongest free radical we have, and it goes to the membranes. It looks for positive binding points in the membranes, and it causes harm in the function of cell membranes.
I do phospholipids intravenously essentially. I do high dose essentially for my patients. They stabilize membranes, but all the inflammatory factors are going up.
Yes.
So then what you see...
I'm not doing that for that reason.
But you see what it does? For that temporary stabilization, you can follow it up with another treatment,
Yes.
which makes that treatment much more effective. So you can alternate that, and that's what I've been doing. But again, it doesn't last long, probably exactly for that reason that you just mentioned.
Yeah, I mean, you have to put them on... if you give B12, you have to give it intramuscular.
Yeah.
Orally, it's immediately, if you do it sublingually, it's immediately excreted. In the gut, it's not taken up. And so you have to give it intramuscularly 3 times a week in high doses. My colleagues in the US are using up to 120 milligrams a week. I go to 30, 40 milligrams a week. That's usually enough. But I know of doctors that use extremely high doses of hydroxycobalamin It is non-toxic, it's excreted through the kidney.
The,
But if you give it intramuscularly, it stays 48 hours in the body.
the only issue that I see with it is actually stimulates bone marrow, and I'm giving something another kinase to make sure it's not gluten deficient because the thickness of the blood goes up.
This effect of the NO activity is too high. That can also be caused, some people tell me, by the gut flora.
Yes. But there are other things by the gut flora that we're looking at now, like ammonia. These people have increased lactate, D-lactate in their blood, which then impairs their memory, because the brain cells can take up L-lactate and sugar, but they cannot do anything with D-lactate. D-lactate is from gut bacteria, and D-lactate is taken up by the cells and the mitochondria. It's toxic for them. So, I do this fructose test sometimes. People with fructose malabsorption, and you can see that your bacteria start making a lot more D-lactate. You see it 4 hours after you give the fructose the first peak, and then 6 hours another peak of D-lactate, and it goes together with memory and concentration problems. So it's the D-lactate is toxic for your brain cells. Brain cells cannot use fats, obviously, because the brain is big ball of fat, and so they only use sugar and lactate. But the cells cannot make the difference between D and L-lactate, but the D-lactate, there's no enzymes to take care of it. Only the liver can break it down slowly. But in the peripheral blood of patients, you find increased D-lactate levels after, well, they're already elevated a little bit in most of them, but if they eat certain foods, you see them go up. And you see that their speech gets impaired, and they get. We did some small studies in individual people, just for the disability. We showed that was the mechanism of the disability.
What are your treatment strategies for these parameters?
Well, my treatment strategies, I'm very. The outcome is for me the most important, and people have to have confidence. So if you make them better within the first month, you have to change those things that make them better the first month. Okay? So things that have an influence 6 months from now, that's no good. You have to start with those things that have immediate effect, and you get good treatment follow-up with these patients. So. We start with an elementary diet, which is patient-specific. We do a lactose and fructose bread test, and we do a food IgG panel, and that gives me a gross idea of the problems that these people face. This is not a solution of the disease, but it makes them 20–30% better. And often already after that, women who have to be driven to the clinic by their husbands because they cannot find the clinic, they find the clinic because their brain is working better. And so my nutritionist is one of the most important people in the first phase of the disease.